Good, okay. Now, what we're gonna do, okay, I'll just need you to do a couple of movements with your head first, okay? Alrighty, now, I'm gonna have them do all three of them all at once, okay? So I could just make sort of life simple for me, okay? So can I just see you, sort of bring your chin towards your chest for me, please? Go all the way down as far as you can. So, get an approximate idea. Can you bring it back up? Now tilt your head back as much as you can. Right? Try not to arch your back though, okay? All right, tilt your head back as much as you can. Good. Alrighty. And this one, what's he doing?
Leaning back.
He's really trying not to do that, okay? Try to keep your back straight. Now bring your head back. Thank you. Alrighty. Because again, what's back here? What are these guys? Are these multi-joint muscles right here?
Mm-hmm.
Alright, so there is probably some active insufficiency going on. That's why he automatically leans back. So you want to instruct him, keep your back straight as much as you can, right? And then have him tilt back, okay? Right? And you get some, every once in a while you may need to give him that little tactile and verbal cue, extra cue. Don't bend your back, right? Okay. Now can you bring your right ear to your right shoulder for me? Good. Now go the other way. Good. Try not to, bend your trunk at this point, okay? All right, as best as do it one more time. Good. All right, and the other way. Good. And can you bring your chin to your right shoulder? Good. Now the other way. Good. Hey, did everybody see that coupling of motion, by the way?
Do it again.
Do it again. Do it again. Alrighty, and go the other way so they could see. Sorry. Did you guys see that? Was it a pure rotation? No. Okay. And the cervical spine area, you can definitely very easily see coupling of motion. Alrighty? Because what? Multiple joints are coming into play. Different orientation of the facets here. So that's going to change or contribute to how much actual lateral flexion and rotation that he can isolate. And it's most of the time, as soon as you ask him to rotate, okay, do it one more time to the right, to the left, now the other way, alrighty, you could see, right, good, alright, and that's the coupling of motions, alright, so, he's facing that way, I'm gonna go over here, so, pick the size of the goniometer that happens to work for you, okay, to measure. We're gonna start we're gonna do flexion extension first. Can you see that? You see that he's tilting back a little bit?
Yeah.
Well, now he's not doing it. I try not to, just look straight ahead as best as you can, okay? Don't tilt your head back, okay? A little bit better. All right, so what we're gonna do is we're gonna line up the goniometer to the external meatus, okay, for the fulcrum. Alrighty, you are gonna line up the moving arm to the base of his nose. Does everybody's nose look exactly the same? No. Some people, some people use the base of the nose. Some people sort of use the tip of the nose. Be aware, that's gonna sort of change your starting position in a way. Yes or no? Alrighty. So, because if they have, a tip that's slightly higher than the base, alright, that could be that can be construed. Say, ooh, they're a little bit hyperextended. Alrighty. So you need to sort of be aware. Are they actually hyperextended, or are you not? Or is the landmark that you're using contributing to that? Right. So you need to sort of look at him, okay? Definitely you need to, again, rule of three, do this actively. Look what he's doing, look where he's starting, actively see what he has, and then measure and see what he has, okay? Alrighty, so, in our book it says, the external meatus is the fulcrum, stationary arm is perpendicular to floor, moving arm parallel to the base of the nose, okay? So, right, I'm going to do the best I can to stay to the base of the nose, because if you could see, I'm not sure if you could see, this is where his external meatus, okay, you guys can look on the other side, external meatus is not perfectly in line with the base of the nose. That's his whatever, that's him, okay? So you're gonna just have to sort of find that spot, okay? Because it's not like using bony landmarks at this point, all right? It just isn't. All right, okay. All right, what's another thing, okay? Another thing, you gotta take a look at the goniometer. It's not gonna fit, all right? It's just not gonna fit. So I'm gonna be out here somewhere, all right? So again, sort of make that imaginary line to line everything up, okay? All right, so stationary arm, perpendicular to floor. So what I'm doing right now, I'm picking his spot. It's not exactly at the external aortic meatus. Oh, I forgot what this part of the ear is called, right? But just the tip right here is lining up a little bit better with the base of his nose, okay? It's just lining up a little bit. So look at it, right? So when you're doing this on the practical or when you're practicing, you know, what I'm gonna see is, you know, I wanna make sure, you know, that you're picking landmarks appropriately. It's not, you know, way up here or way down here or anything like that, okay? All right. All right, so on the count of 3, okay, can you just bring your chin to your chest for me, please? 1, 2, 3. All right, then you're gonna go, you gotta move at this point. Move your goniometer, line everything up again. Stop. Okay, we're gonna do it one more time because my goniometer moved. Hold your head up like you did before. Okay. On the count of 3, 1, 2, 3. Okay. I got my starting number. I went down, line them back up. You do. All right. Pull it away, and he is at 10, 20, 30, 40, 50, 53. 53 degrees. He's a little bit more. Alrighty? So you could see, alrighty? You're gonna have to move the goniometer because everything moved, okay? Now, always make sure you realign your goniometer. On the practical, most of you guys did it on the practical. Make sure, if it says it needs to be perpendicular to the floor, make sure it's still perpendicular to the floor. Some of you guys sort of, you know, forgot that part, okay? So, and that influences the number. All right, so just be aware of these little things, okay? All right, because you guys are very focused on the moving arm, all right, and the fulcrum. Not so much on the stationary arm. Look at the stationary arm, because that will change, okay, the results that you get, right? So he had 0 to 53 for cervical spine flexion. All righty, let's see what he has for cervical spine extension. All right, relax, okay. Okay, all right, so on the count of 3, all righty, can you tilt your head back for me, keeping your back straight as you can, okay? 1, 2, 3, all right, move. Sorry, not me, I'm moving. Okay, he has 10, 20, 30, 40, 54. 54 degrees of cervical hyperextension. So, 0. All right, questions on that? Yeah, go ahead.
Could you just turn the goniometer upside down and get it closer to his face?
What do you mean?
If he's a stationary, like,
Yeah, have it
Yeah,
this way?
Parallel to the floor?
let's make it so, oh, you want it parallel to the ceiling?
yeah.
No,
Yeah,
still perpendicular to the
perpendicular
floor
to the
or
ceiling.
ceiling, but
Uh-huh.
just upside down. You know what I'm saying? So that it's stationary.
Oh, you want it this way?
Oh, like
Yeah,
that.
could you
Yeah.
do that and get it closer?
So then you wouldn't have to move it once, well, I guess you
You're
could.
still gonna have to move it no matter what because he's moving, okay? I mean, yeah, if it works for you,
Okay.
alright? I mean, the thing is, I just find it a little bit more difficult sometimes particularly when I do extension, it's going this way and it's gonna hit into me. I mean, so it's up to you, okay? Yeah, so it can be perpendicular to the floor, the ceiling, because that's not gonna move, right? Hopefully. Hopefully that won't move, okay? Alright, now you just need to be aware that you're gonna have to shift the fulcrum when he's flexing and extending, alrighty? Because it's again, summation of movement, that we're using something that's not technically part of the cervical spine itself, alright? That's why we need to sort of shift everything, okay? Yes or no? Good over there on that side? Alright, how, if I wanted to, like this, extension to flexion, what would I put? How would I document that? Extension to flexion.
54, 202, 53,
54,
0,
0, yeah, to 53, okay? Alrighty, right? You just need to make it known that this one is extension. So a lot of the times, depending where you're at, okay? If you're looking, okay, we'll just stick to cervical spine. You know what? They'll just do something like this, flexion to extension for everything, alrighty? If you're looking at upper extremity, alrighty, flexion to extension, alright? And then you would have shoulder flexion, shoulder AB, things like that, okay? Looking at it that way, okay? You need to make sort of just keep an eye on that, okay? Alright, so moving along. Cervical spine lateral flexion. Okay. Oh, actually, we need to do a little palpation before we go ahead. Who's getting a tank? Come on, switch spots. But you could stay for the next round if you want. Okay? Alright. Okay. Your C7 spinous process. Okay? Alrighty. When you flex, it is usually the most prominent spinous process. Okay, everybody's bending their head now to sort of find it on themselves. Alrighty. It usually lines up to be, okay? Now, when you're looking at the palpation, okay, alrighty,
You have a bony neck.
you look of it, it's the most, like I said, it's the most prominent one, alrighty? Now, how you can sort of check now, you okay? We'll be doing this, okay? Alrighty, when we find it, is you're gonna need to sort of palpate for the other ones too. So when you're looking at your spine of your scapula, remember that? Remember finding that thing? Alrighty, it is gonna line up with T3, T4 area. Alrighty, so you're gonna find the most prominent spinous process, okay, is C7, and you're gonna just slowly walk down to see, does it match up, right? So you can find your spine of the scapula, palpate medially, and see if you land on your T3, T7, T3, T4 area, and then work your way up from there. So it's more like using as a confirmation for your palpation, okay? So, alrighty, so I'm gonna go, can you put your hand in the small of your back for me? In the small of the back. Alrighty, where are you? Okay, here you are. Alrighty, here it is. Now, put your hand down. Alrighty. If I go laterally from the spine of the scapula, what am I eventually gonna hit?
Chromium.
Your chromium process. So I'm gonna make sure that I'm on the spine of the scapula. Alrighty, so I'm gonna palpate laterally. Alrighty, and I feel like a flatness right on her. Alright, gonna go back now. Alright. Alright, stay there. Alright. Right now I'm on the medial edge of her spinous scapula. So I'm gonna walk over, alright, till I get to a spine area. You okay?
Yeah.
Alrighty, so, alright. And when you're looking at the spinous processes, are they sort of pointing downward? Or more like, more horizontally at you?
now.
Down.
So they're starting to go downward in your thoracic spine area. So what you're gonna feel for as you go up now, right? As you go up, they're gonna start being a little bit more. So I'm on T3, okay? Hopefully I'm on T3 right now for her. So I'm gonna slowly palpate up her spine. Are you good?
Yeah.
Okay, all right? And I'm gonna feel like a gap, all right? And that gap is normal. Why? Should there be a slight gap?
Yes.
Yeah, there should be a slight gap. And then I'm gonna feel for another. Hopefully, okay. Right here, another one. I should be on T2 now. All right, moving up. You okay?
Yeah.
All right. Gap. Okay. Okay. Now, I should be on T1. I moved up a little bit. Alrighty, so now can you flex your head forward for me? Alright. A little bit more? Okay. Alrighty. So this is her most prominent one. Alright? Sticks out. And you know what? Pretty much lines up at the base of the neck. So what I'm gonna do is keep palpating up. See if I feel. Yeah. I was probably more at T2. So this is how you sort of confirm everything, okay? I was off by 1, because not everybody's spine of the scapula is gonna line up exactly in between T3 and T4. So there is a lot of play back and forth for everything. So for her, okay, here's her C7 spinous process, okay? So that is her fulcrum. While you're here, do you mind? Okay, alrighty, so I'm gonna keep my finger here, alright? Alright, to make sure I'm gonna line up everything. So, keep my finger. Just line along here. Alrighty, so that's your fulcrum, okay? Try to keep your back straight, look ahead, alrighty? Alrighty, so the fulcrum is gonna go on the C7 spinous process, okay? Stationary arm or proximal arm will go straight down the spine, following the spinous processes, okay? Alrighty, and this, her moving arm, is gonna go line up now with right in the middle of head. Don't use the ponytail, anything like that, okay? Because is it exactly in the middle? Her ponytail is not exactly in the middle right now, more for the fact I moved it over, so I could, look at the base of the neck. So I'm gonna take it away now, okay? Alrighty. Alright, I'm skipping the active range of motion part right now since I got her landmarks. So I'm gonna keep her here. Now, can you bring your right ear to your right shoulder for me? She's starting slightly at 1 degree laterally flexed already. That's just her. Alright, so can you bring your right ear to your right shoulder for me? 1, 2, 3, go. Alright, as far as you can, far as you can, far as you can. That's it, okay? Pull it away. Ah, shoot, I moved it a little bit, okay. Alrighty, I'm sorry. Bend your head one more time, okay? Bend your head, just bend it, no, bend it forward so I can find your C7, okay. Now back. Okay, right there. Alrighty. Okay. Alright, so, yeah, she's still starting in 1 degree. Alrighty, so bring your right ear to your right shoulder for me, please. 1, 2, 3. Good. Alrighty, gonna pull it away. Bring it back up. 10, 20, 30, 10, 20, 30, 35 degrees of right lateral flexion she has. Okay? Right. Okay. Can you bend your head forward for me? Okay, good. Alrighty, bring it back. Okay. Alright, still in 1 degree of right lateral flexion. Can you bring your left ear to your left shoulder for me, please? 1, 2, 3. Go, 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 go. As you can. Good. Alright. 10, 20, 30, 41 degrees. So she has a little bit more range of motion on her left lateral flexus. Why possibly? You think?
She's starting a little right. lateral.
She's already she's already a little bit right laterally flexed, but she has more, but she has 45 degrees of, 41 degrees of left lateral flexion. Any particular reason?
She
Just tight right lateral,
Yeah, possible. Tight right what?
lateral flexors.
Okay. Yeah, possibly. Alrighty, so she was 1 to 0 to 41. Okay, and that was her left.
where you put your phone on that side.
Diana will have more range of motion. if she-
1,
yeah,
2, what did we say before?
35.
I think 35, right? Okay, does that make sense on how we document it? Alrighty, so 1 to 0 to 41 for left lateral flexion. Alrighty, 1 to 35 for right lateral flexion. Alrighty, so she started in 1 degree on right side of lateral flexion. Alrighty, so what would her range be here?
34.
34. This is math. This is math. Alrighty, what would her range be here? 42. Okay. Alrighty. I mean, is that 1 degree always significant?
No.
Always. No, not always. Okay. Could be the fact maybe she just has a little, can be a muscle tightness on one side. Right? It can be something in the facet joints on that one particular side that's limiting the motion. But I want you to sort of get out of here. It's just one piece of the puzzle. Alrighty? The things that we're doing right now is just one piece of the puzzle. We're gonna tie this in, okay, with looking at her passive range of motion and flexibility. Right? We're gonna tie it in with her muscle strength. Okay, we're gonna tie it in whatever she decides, her signs and symptoms, righty? We don't know, maybe it is significant, maybe it's not, right? We're gonna tie everything in together. Questions, right? So you could sort of get a bigger picture of everything. Good, okay? So that's with lateral flexion. Question?
How can we find the moving arm? It says the occipital protuberance. It's kind of hard.
Yeah, that is hard to find, okay? I divide the occiput and the cranium in half, right? Not by the ponytail, okay? Don't do a ponytail, because not everybody wears their ponytail right in the middle, okay? Right? So what you want to do is make sure when you're using, yes, it says the occiput protuberance. The occiput protuberance is right in the middle, and it should be dividing the head, right side, left side. Right? So you want to use, your landmark, divide your head in half. Okay? Good? Okay. Alrighty. What's the next one? Do you want to stay or do you want to make it?
You wanna go? It's okay.
Okay.
Make it safe.
Okay. Alright. Alrighty. Next one, cervical rotation. She is sitting, okay? Again, good posture. Alrighty. So you're gonna need to put the rotation. Alrighty. What you're gonna be using, okay? Alrighty. You're gonna be using a spot on her head. Again, it's summation of motion here. So you're gonna make sure you need to sort of use the same spot on that same patient all the time, okay? There's no actual bony landmark that you can use, right, for your fulcrum, right? Your moving arm, okay, is gonna going align with the tip of the nose. Sort of look at that nose because usually you're gonna be able to see the nose when you're standing over them to measure it. Right? You're going to be able to see, right? And you're going to have your stationary arm, okay, align with the acromion process, right? Because that's the landmark that's not going to move, hopefully, right? All right, so can I just see you turn your head to the right? That's good. Turn your head to the left. You guys see the difference? All right. She does not have that coupling of motion that Darren had, right? She really is able to sort of isolate that rotational component, right?
Yeah.
Okay, why?
When you say coupling emotions,
Why,
I think
Darren?
it's like multiple muscles.
Well, don't say muscles, because it's, the muscles, when you're doing something like that, they're all multiple muscles, okay? The coupling of motions is due to the different changing orientation of the facet joints in the cervical spine. That's why there's coupling of, there's a combination of the motion. Yes or no? Okay? Alrighty? Okay, I need a stool to do this. Get that for me. Put you forward a slight, okay? Okay. Alright, so try to keep as best as possible, okay? Now, is everybody's acromion process gonna be in this nice, pretty alignment? No, she has good posture, okay? She has good posture. Alright, so again, since it's a summation of joints here, alrighty, you're gonna need to sort of make sure you know which landmark you're gonna be using, just in case it doesn't line up with the acromion process of what proximal arm. Alright? Okay, so I'm gonna, okay, line everything up, right? So, at this point, you know what? My spot, okay, for the fulcrum is gonna be a little bit more posterior on her cranium. Because you know what? I wanna make sure I got this, okay? Because this is exactly where it's supposed to be. Alrighty? And I'm gonna look forward overhead. Alrighty? Okay? I'm lined up with her nose. Okay? To the tip of her nose. I put everything in. Alrighty? She is starting at 0. Hold on. Okay. She's starting at 0. Alrighty? So, can you, on the count of 3, turn your head to the right for me, please? 1, 2, 3. Good. Line everything up. Okay. Alrighty. And she went to, hold on, 10, 20, 30, 40, 50, 60, 66 degrees.
That's like double.
Okay? She has 66 degrees. 10, 20, 30, 40, 50, 60, 66 degrees. Okay? I'm going to measure over to the right, so I'm going to switch over. Okay? To the other side. Okay, she's starting at 90 or 0. So on the count of 3, can you turn your head over to the left side now? 1, 2, 3. Go, 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 go. Okay? Okay. Relax. 10, 20, 30, 40, 50, 62 degrees. Alright? So she has 62 degrees of rotation. Alright, to the left side. Yes or no? Okay? Alright, questions on that? Good?
Kevin has a question.
Yeah, go ahead.
Not on that particular, but can you go over again, how did you find cervical?
Yeah, we're gonna go more, we're gonna do the whole palpation again, okay? Alrighty, we'll go over that, okay? Alright, questions on that? Yeah.
It says 90 in parentheses.
90 degrees, it's accepted normal. This
Oh,
is
wow.
accepted normal. Alrighty?
Okay.
Yeah.
That's a lot.
That's a lot, I say, okay? Because again, depending on patients, yeah. Some people do, I've seen people do it. I said, ooh.
Wow.
Alright, but it is the accepted normal, okay? Alrighty, now, okay? Right, looking at that, okay, there are variations, because what are we talking about here? That can limit the amount of motion some people may have. There's a lot of variability. What can happen? What are we talking about over here, these guys? Are there multi-joint muscles there?
Yes.
Yes. Are there single joint muscles there?
Mm-hmm.
Yes, they are. Okay, we didn't talk about them, but they are. There are. Alrighty. So looking at that, okay, that's many things that can interfere with exactly how much range of motion they have. Okay. Yes or no? What we want to see when we're in the clinic per se is the fact that do they have more or less equal amount of motions on both sides, right? And is their head in a midline position? You remember midline position from anatomy? Alrighty? Midline position, you're looking at, is the head where it's supposed to be technically? Alrighty? Is it more forward, more into the frontal plane? Is it more forward into the frontal plane? Alrighty? Is it more forward into the frontal plane posteriorly? Alright? Usually not. Usually it's more anteriorly. Alrighty? Are they holding their head, alright, more into one of the sagittal planes? Okay? Alrighty? Or is it some weird combination where they're holding their head somewhere in the frontal and sagittal plane, which is a common thing to see. Look at some people, and in the subway or on the buses here, look at how people are holding their head normally. Alrighty? So looking at that, you're gonna see that sometimes they're not gonna start at zero. You guys are starting at pretty much at zero for me because you guys, there's no issues right now. Alrighty? When you have somebody in the clinic here, alrighty, let's say, you know, it's a whiplash injury, okay? And they're like this, kind of thing. Alrighty? What do you think one of my goals would be at this point? Are they stuck on one side? Yeah, I'm stuck on the left side somewhere in lateral flexion and a little right rotation. What do you think one of my goals would be?
Straighten it out.
Straighten it out. Yeah, I gotta straighten my head out. Alright? So your goal at that point is getting them back into a more midline neutral position as possible. Alrighty? So at that point, you're gonna measure how much they're in the left lateral flexion and right rotation and try to get them back into that nice midline neutral position where it should be. Yes or no? Okay? Right, and that's why we want to take the range of motion. If you have an actual patient in the clinic, yeah, that has one of these things, and one of the goals is to get them back into normal midline position, you want to know what their actual measurements are, and it's going to be abnormal, and you want to try to at least get them back into neutral. Yes or no? Okay? Yeah.
When you're measuring rotation though, how can you make sure they're not like protracted or?
You do try to get them in their normalized position, a more normal position,
Just
upright
by,
position.
like,
By eyeballing it, alrighty? And if I'm eyeballing it, and she is, can you do a forward head? Okay, she's not really good at doing it, but she's doing it, alrighty? If she does a forward head, and she actually says, no, I can't bring it back, because that's why they're there to see you. You're gonna need to document that she's in a forward head position, okay? Yes or no?
Yes.
Alright, so, moving along, okay, we're up to thoracolumbar, right? Okay, so what we're gonna do, let's do more of the palpation first. Who has like a t-shirt tank on?
T-shirt tank?
Yeah, you know. No? Okay, you okay?
What's
Yeah.
a t-shirt?
Well, just a t-shirt that's tank. Yeah,
Oh.
anybody? Okay, alrighty, can you do one of these? Put it up and... Okay, thank you. Alrighty, you know what? We'll turn so they can see. You know what? Sit up here so they can see. Alright. Alright, so with the palpation. Alrighty, C7. Oh, thank you. Alrighty. I mean, it's the most prominent one. Okay? So can you bend your head down? Bend your head down. Alright? Usually that will be C7. And what you're gonna do, alrighty, you're gonna look, alrighty, palpate. One of the ways you could find T3 and T4, alright, palpate your way down. Alrighty? So if this is her most prominent one, alrighty, you're gonna palpate your way down. Hold on to it. Alrighty, so looking at it right here. Right, bring your head back up. You want the chair under your feet? Okay. Alrighty. So what I'm gonna do, can you sort of round your shoulders for me a little bit? See if that helps us. Alrighty. You know what? Don't do that. It's not helping me. Okay. Right. So again, use things that sort of helps. Okay. This made it a little bit worse because it just got in the way. Alright. So I'm gonna palpate my way down. So if I'm on C7, what's the next one should I be finding?
C6.
T1?
Or
Yeah.
T1.
Yeah, T1. Okay. So
Yeah,
looking,
going
so
up,
this
down.
is going down. So that should be T1, working your way down. Be aware, these are spinous processes, okay? It can be a little bit annoying, okay? When you palpate them, alrighty? And when you palpate them, looking at the your skeleton, are they sort of overlapping a little bit when you go from T1 to T2? So you want to make sure, alright, that you're at the tip of it, alright? Because that's going to help. Because if you're not at the very tip of your spinous processes, it can sort of get a little confusing with the numbers. So you always want to make sure. Alrighty? Alright. So I'm on T1 right now, so I'm gonna move this aside a little bit, okay? Alright. Okay. Alright, this should be T2. Alrighty. Alright. Next one should be T3, right here, I feel it, right? Moving down a little bit. Right, next pointy thing I feel is T4. So, T3 and T4 are your corresponding landmarks to your cervical spine area. Right, so I'm gonna move my fingers a little bit, righty? Can you, I'll do it this way. No, that's okay. Here's her acromion process. Right, so this is her scapula of the spine. Go laterally, sorry, medially. Alright, keep going, keep going. Alright, here's the medial aspect. Okay, sorry. Alrighty, get over here. Alrighty, and she's good. She lines up right in the middle between T3 and T4. Alright, now when you're looking at people, sometimes the spine of the scapula can be right on T3. Sometimes it can be right on T4. What it shouldn't be, right on T6 or something like that. Okay, it shouldn't be there. Alrighty, so you're using the landmarks that you found for your shoulder. That's gonna help confirm your landmarks for the cervical, for your spinous processes. Using your landmarks on in the trunk area is going to confirm everything here. So like it says on for T7, it should be at the inferior angle. So I'm going to work my way down again. Alrighty, so this is 3, this is 4, sorry. 5. 6. Okay. 7. Can you do that? Okay. Can you put in hand smallly back? Where are you? There you go. All right, relax. Okay. Alrighty, so I need somebody here. Can you do me a favor? Alrighty. So thank you. Alright. Can you just hold this to one side so they could sort of see? I'm gonna get my finger over here. Alrighty, so you can sort of see it's lining up together, okay? This is where her inferior angle is, and this is where her T7 is, okay? Alright, so again, it's approximately, okay? Can be a little bit below T7, okay? It shouldn't be at T10 or something like that, alright? unless there's like some huge postural thing going on, all right? So, working way down, so that's, thank you, so that's how you're gonna sort of find your spinous processes, okay? Find one major landmark, alrighty? If they have a very prominent acromion process, and you can follow that down to the medial side of the spine of the scapula, you should be able to find your way over to the spinous processes, okay? If they have a very prominent C7, right? And some of you guys will, okay? That will help you sort of, follow your way down to the other spinous processes, right? So there's different methods of doing the palpation. Yes or no? Okay? All right. S2, okay? You guys remember where your S2 should be? Down there, yeah, we know it's down there somewhere. What other major landmark do you think? That's down there. Your iliac crest, okay? Your posterior aspect of the iliac crest, alrighty? That's where it will be lining up, right? Are the spinous processes gonna be prominent in your sacrum? No, not really. You may be able to palpate some bony ridges, alrighty? But they're not gonna be as prominent like, say, your C7, alrighty? So you're, again, looking at that, you're gonna try to use the other landmark. Your S2, alright, will be in line with the posterior aspect to your PSIS. What is your PSIS from anatomy again?
Posterior superior iliac spine.
Yeah, posterior superior iliac spine, right? Sort of an easy way to find that, alrighty? It's associated with these little divots in your lower back, right? Little dimples. The little dimples in your lower back, okay? Alrighty, so if you find those little dimples in your lower back, go medial on both sides, you will be on the S2 level. Yes or no? Good? Okay. Alright, so, okay. Do you mind? Okay. Alright. Okay, I'm gonna sort of need you to, you're gonna stand up for me and I'm just gonna, I'm gonna palpate over her clothes a little bit, okay? Alright? Alright, before I do that, do you know where Mr. Mitchell hides the tape measures here? Okay, in one of these doors? Puts everything away for us. And I need that. Okay, so, where's a good spot? Here, you stand here, okay? Sort of, can I raise the top a little bit? Can I raise your top? Okay, alright, so turn like diagonally. Stand in front of me diagonally. Yeah, right there. Alright, so easy ways to sort of get ahead now. Easy way to sort of find your iliac crest. Put the heel of your hand right on your hip. Alright? Alright? That is your iliac crest. That's everybody's iliac crest, okay? Turn your fingers, your thumb backwards. Usually works. It should land right on your PSISs. Right? You may need to sort of move medially if you happen to have, short fingers. Alrighty? But finding the iliac crest, alrighty? The heel of the hand, alrighty? Right there. Turn your fingers, boom. Okay? Alright, so I'm gonna hold here. Okay. Okay. Do you, right here is her iliac crest, okay? Right? Right, I'm gonna move a little bit medially, because I do medially, right? Until she's right on her sacrum, S2 area, her sacral S2, right? And that is using a landmark, right? That we're gonna measure for this lumbar, thoracolumbar flexion and extension, righty? right? There are certain people that use an inclinometer, alrighty, where you can take a little bit more accurate measurements. Right? An inclinometer, you need 2 of them, alrighty. Basically, what you're looking at, it looks like a timer to me, alrighty, right? Where you are placing the inclinometer at her S2 area, and then another one at her C7 area, alrighty. And while you're holding it in place, alrighty, you're gonna either ask her to flex forward or extend backward, and you will get 2 numbers, and then you're gonna subtract those 2 numbers to get together. Oh no, sorry, add those 2 numbers to get the amount of range of motion. Right? It's a little complicated way to do it. Right? We're gonna choose the easier way to do it. Okay? Because life is easy. Make life simple for us. Okay? Because it will give us the same results. Right? Right? Instead of using degrees, we're gonna use inches or centimeters. Right? So I'm still at her S2. Bend your head. Okay. Here's a C7. Alrighty. Right? I'm gonna hold on to this. Yeah. Starting at 0. Oops. Thank you. She is 18.5 inches long. Alrighty? Right? 18.5 inches long. Okay? Now, when she bends forward, okay, what should happen to the number at this point? Should it increase or decrease, you think? Increase. Alrighty? So what you're gonna do is take the difference between the 2 numbers. Alrighty? And the accepted range for flexion here is a change in 4 inches. As long as it's not more than 4 inches, or there's no change at all. Okay? That's the accepted range. Yes or no? Mm-hmm. Okay? Now, okay, can you, sorry, let's get all this stuff out of the way. Right? Can you place your hands, okay, on your front part of your thigh? Alright? Can you just slowly slide down for me? Alright? Try to, keep your, do whatever you want. Just slide down. Okay? What we want to see is how far she goes. Alrighty? And see if she has, and bring it back up. Alrighty? If she has any significant tightness in her, what muscle you think? That may play a role. Which one? Huh? Her hamstrings. Okay? Alrighty? Now, if she had significant tightness in her hamstrings, what might be one thing she'd do? She might bend her knees. Okay, absolutely. She might bend her knees, and she did not. You guys saw. Did she bend her knees? No. Okay? What else may she sort of do? If you've got really tight hamstrings, what may they try to do?
Bounce.
Huh?
Bounce.
No, they're not going to bounce. Right? Well, if they do bounce, you tell them not to bounce, by the way. That's not good for them. Right? Because people do that all the time. What may they try to do? Close. They're not gonna tilt, right? But they're gonna shift her weight, okay? Right? Or shift actually her whole lower extremity more posteriorly, right? She'll do where she'll stick, okay, all the way out so she can do it, right? Right, that. Or if she's that tight, she just won't go down as much, okay? Right, so can you do that one more time for me? Alrighty, and you do want to make sure you ask them to go slow. Bring it back up. Alrighty, why? Huh? Yeah, you might pull something. Alrighty, and something might happen along the way that you may not have seen. Okay, if they went too fast. Alrighty, so she was, what did we say, 18 and a half, right? Okay, can you do it one more time? Oh, let me get your S2 again. Okay. Okay. Okay, can you go one more and slowly slide down? Go ahead. Try to relax your neck a little bit. Go as far as you can. Okay. Okay. Alright, I found her C7, and she went from 18 and a half to 21. So she's within that acceptable range, which is what was indicated when I grossly looked at it. Right? She didn't do any shifting of her whole body weight posteriorly. Alrighty? She still slid down to the same amount of motion. Okay? Now what should happen when she hyperextends? Should she get more? Should the number increase, the distance increase, or decrease?
Decrease.
It should decrease a little bit. So she was 18 and a half. Somebody remember that for me. Alright? Okay. 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 Okay, so can you, okay, actually, before you do it, put the hand into your small of your back. Okay? Small of your back, sorry. I'm just doing that, okay? Alrighty, do it like this, by the way. Like this. Okay? Alrighty, can you, why did I ask her to do that, by the way?
Support.
Just extra support. Can you slowly arch your back for me? Okay? Good. Alright? And relax. I'll take a good look at it. Bring it back up. Now what would I be looking out for here, you think? Yeah, if she actually does what we call anterior type thrust. Okay, if she does an anterior type thrust, because what you want to see is everything is still in alignment. Okay, you want to see, is her pelvis still in line with her hip joint and her knee joint, and down to her ankle joint. Okay, right? Okay, so. Okay. Okay, can you slowly bring your, lower your back, arch back for me. Go as far as you can. Okay, right, be aware, don't look at her neck, good. Right, relax. She has 16. She went a little bit further, because the accepted range is, normal range extension is 2 inches. She went a half an inch. Am I gonna worry? No, I'm gonna see what else is going on, okay? So that's using the tape measure method, okay? And that's what we're gonna be doing, okay? Now, for lateral flexion, okay? For lateral flexion, you can use the tape measure also, and there's 2 methods that I'm gonna show you. You can use the tape measure method, okay? What you're gonna be doing for that here is you're gonna be measuring the distance, alright, from the tip of her longest finger to the floor, alright? So you're gonna have your hands at your side, okay? Alright, alright. Can you just slowly go down for me? Like slide your hand down, like you're gonna bend your trunk, Diana, and you're gonna go that way as far as you can. That's it. Okay. Alrighty, come back up. Alrighty. Can you go the other way? A little bit more. And do the right side again. Okay. And back. Now, sort of looking at this for this one, right? And actually for all your trunk, you want to make sure you take a look at both sides, right? Because you're gonna you want to look at the amount of motion. Now, when we're looking at this, we're not technically really looking at the amount of motion. We are, but the fact is we want to look at the muscle flexibility more when we're doing this. Okay? So we're going to be looking at that. So there's a tape measure method of doing it. So, all right, thank you. All right, can you, all right, again, looking at and taking the normal first. $25 and 3/4. She has 25 and 3/4. Okay. All right. So can you slowly slide down for me, for as far as you can. All right. That's it. All right. And she, 16 and a half. 16 and a half. Again, you're looking at the amount of range here that she has, okay? This is just looking at the amount of range, okay? Now, if you wanted more flexibility on that side, you're gonna see, what do you wanna see? An increase in the numbers or a decrease in the numbers?
Decrease.
Decrease. Good. All right, if you're looking at the flexibility. All right, questions on that? All right, now, if you wanna do goniometry-wise, all right, you're gonna use the landmark, okay, of her S2, all right, and you're gonna use the other landmark, all right, for her moving arm is gonna be pointing to what, you think?
Up and down.
C7, okay, right up to it, okay? Now, does everybody C7 and S2 gonna be lining up the same? No, again, that's when you sort of take liberty, okay, of choosing that landmark, okay? You guys are normal, so you guys will be using a C7, hopefully, okay? Alright, pretty from just looking at you guys right now, you guys should have no issues with that. Alrighty, so I'm gonna use her fulcrum, is her S2, alrighty? Her distal arm is gonna be lined up with her spinous processes going up towards her C7, right? Her proximal arm or stationary arm is gonna be perpendicular to the floor. Yes or no? Okay? Alrighty, so, you want to turn that way? So they could see. No, you're not? So they could see. Oh, face up. Oh, no, a back, your back face up. Okay? Alright, so they could see. Okay.
Standing circle.
Alrighty. Okay. Alrighty. Can you just sort of bring this to the front a little bit? Thank you. All right. All right, bring it slightly away a little bit. All right, she is starting at 0. All right. Can you, on the count of 3, okay, right, slide your right side, right arm down your right leg, okay? 1, 2, 3. Go as much as you can. Alrighty. Okay. Alright, come back up. So she went from 0, 10, 20, 30, 39 degrees. Okay? She went 0 to 39 degrees of right lateral flexion. Yes or no? Okay, and again, for that, for the other one, for the left side, I would take it also, okay? Because you want to, when you're looking at the trunk, you want to have that comparison. Yes or no?
Mm-hmm.
Okay, alrighty, last one, cervical, trunk rotation.
Professor,
Yeah, go ahead.
do you do the passive range of motion?
We're gonna talk about that in a minute, okay? Okay, we're gonna talk about that in a minute, okay? Cervical range, trunk, thoracolumbar trunk rotation here, right? We're gonna have her in a sitting position, right? So depending what works for you, she can be sitting on the plinth, right? Or she can be sitting on the chair in a slightly forward position, right? So, yeah, sit in the chair, okay? Sort of, you know what? Alright. Okay, now, you're gonna be using the same landmarks, okay, almost, as you were for cervical spine rotation. Alrighty, you're gonna pick a point on top of a head somewhere, okay? Alright, that's the fulcrum. Alrighty, for the proximal arm or the stationary arm, alrighty, you're gonna use the iliac crest, alrighty, and you're gonna be extending it, okay? Sort of, that imaginary line. Here's your iliac crest, the lateral border. You're gonna just have one nice imaginary line going that way, alrighty? Alrighty? Your moving arm is gonna be in line with what, you think? Take a look at it. The acromion process, okay? So for her, can you, in this position, to make life easy for me, can you just scooch up in the chair, alrighty? Now, right, the chair is the preferable sitting position on the chair, alrighty? Because you're gonna want her feet stabilized, alrighty? If your patient prefers to sit on the plinth, okay, you're gonna need to make sure the feet are stabilized. So you're either gonna use a stool, alright, or a chair that's right on them. If you happen to be lucky and you have a table that actually is electronic, you can make the table go down, okay? What works for you, okay? Now, right, so I'm gonna be behind her and sort of make life easy. I'm gonna have her rotate towards her right, alright? So I'm gonna pick a spot on her head. Again, proper alignment, okay? Line everything up. Shoot. Okay. Right, can you guys see? Alrighty. Again, I'm using a spot that's a little bit more posterior to her head, on the posterior aspect of her head, because it just makes life simple for me because everything is aligned up, okay? Right? Her acromion is pretty much in line with her iliac crest, okay? Alrighty? Right. So, she's starting at 0, alright? So I know she's at 0. I'm gonna move the goniometry a little bit just to sort of help me, alright? So on the count of 3, alrighty, can you just turn your trunk towards the right side for me, okay? 1, 2, 3. Go, 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 go. Try not to turn your head, okay? Alright, very importantly, they cannot turn their head. They're only turning their trunk. What helps, if you need be, have them put their hands on their hips, okay? Because that sort of reinforces them, only turn your trunk, right? Because that will askew everything, okay? So sort of keep their hands either here, or just tell them, don't turn your head, okay? All right, let's get you lined up again. All right, and I'm just using an extension, my imaginary extension of the iliac crest. She's still at 0. Her moving arm is lined up with the acromion now. So on the count of 3, can you turn to the right? Keep your head still though, okay? 1, 2, 3. Good. Go, 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 go. All right. Line her back up. All right. Relax. She went to 0 to 30. Okay? Accepted range is what? Close. Okay? Alrighty. So you want to be sure her head is not moving, okay, when she's doing this, because that will skew you a little bit on the numbers that you have. Okay? Questions on that?
So they keep their head.
As best as they can, yeah. Because you don't want your head to sort of influence the motion. So if I'm standing here, alright? My head doesn't move, but my trunk moves. Okay? My chin should be in line with my sternum.
Right.
Okay? My chin should be in line with my sternum. So I'm like this. Right? Not like this. Okay? Because you're gonna have that influence you. Okay? Alright? Questions? Alright. Somebody brought up the point about passive range of motion. somewhere over there, right? Yeah, okay, yes, you still, yeah. Alright, what I'm gonna show you passive range of motion for the cervical spine area, okay? Do you think it's feasible to do passive range of motion to the thoracolumbar area? No, I mean, it's really kind of hard. So there's really technically no end-field test for the thoracolumbar area, right? Because you're gonna have to move the whole trunk, okay? Now, there are people trained therapists that will do like a little end-field test, right, for the cervical area, okay? That is actually a really tough skill to do, all right, because there's a lot of precautions, all right, that comes into play. What can happen? Okay, what's over here?
The person will fall over if you're trying to do that.
Yeah, can fall over. What else can happen? What's here? What's this thing over here? What's the deep thing in there? Carotid, okay? Your spinal cord, okay? So I'm not gonna have you guys do that, but I will show you guys how to do gentle passive range of motion. Okay, and we're gonna do that now. And usually when you're doing gentle passive range of motion for this, right, they need to be in a comfortable position. What's the most comfortable position? Supine. Okay, alrighty. Right, like I said, somebody left a goniometer on the day of the practical, so I'm leaving it here, so you guys can pick it up. So, ready? Okay. Can you sort of head this way, okay? Right. Can you scoot back towards me a little bit? Okay. Put your head in mine. Put your head in mine. Drop it. Try to relax as best as you can. Okay. All right. Are you good? Alrighty. You want them as relaxed as they can. Does this look relaxing in this position for them? No. So you want to just really make sure they're relaxed as possible, okay? Some people, when you're in the clinic, just don't like being with their head hanging off, because what's going to happen? Drop. People don't like that, alright? So I want to make sure that you're resting right in hand. Just put it down. Just try to rest, okay? Alrighty. Right, and what I'm gonna do, okay, and you can see my fingers are pointing downward, okay, quarterly, alrighty, on the occiput, and I'm cradling her head, right? And what you're gonna be doing here, okay, is close your eyes, try to relax a little bit, alrighty. I'm just gonna bring her head up and back down, alrighty, okay, bring it side. Alrighty, relax, okay, alright, right, so I'm doing lateral flexion, little rotation, try to relax, alrighty, and this takes a few minutes, so you're going to be doing whatever happened when you to pick. Alrighty, I'm gonna want you to see this nice relaxing technique, okay? You're gonna cradle everything, alrighty? Most people don't want to be hanging off, right? Because it's just not comfortable, alrighty? Yeah, and I can see she's a little bit better, alrighty? Alright, so if you pick this one, whatever one you happen to pick out, say it's cervical flexion, alrighty, you're going to be using this technique, alright, where you're going to be cradling her head, alright. Diana, do you feel overpressure at all? Just a little, near the end range, okay, alrighty. Just going to go a little bit at the end range. You're not going to apply overpressure, okay, because remember, what's overpressure again? Then to take them to the end range and apply a little bit pressure, okay? Not really doing that with her. I'm just taking her to the end range. I'm not applying any pressure, okay? So you're gonna pick one. Say if you'd pick hyperextension, alrighty? you're gonna have her support her head. Alrighty, get her to relax a little bit. Alrighty, bring her back down. Alrighty, and for hyperextension, can you come off a little bit more? Because the bed's getting in the way. Alrighty, good, relax. And down, okay? Definitely, this is a technique that I'm gonna want to see you guys practice in front of me or Mr. Mitchell. Just to make sure. Alright, because this is your neck. This is an important area. Alrighty, which goes for the same thing when we do manual muscle testing next week for the cervical area here. I'm gonna teach you how to do against resistance, but not necessarily apply resistance. Alright, because again, it's a technique that's very practiced, okay? And this is just a troublesome area. You okay? Alright, you okay? You want me to stop? Okay, I'll keep going or? She's relaxed now. Yeah, it feels good. Alrighty, it feels good. Alrighty. Alright, to do this, okay? It feels good because she's relaxed now. So looking at it when you're doing it on practical, I'm gonna see that they're relaxed or not. Alrighty? So you wanna make sure they're relaxed when they're doing this, okay? As best as you can, okay? Alrighty. Okay, why don't you scoot back up, okay? Scoot onto the, put your head back on the table, in other words, go that way. Alrighty? So when they're there, you're gonna start them off head on table. Alright? I want to see you instruct them to come back off the bed. Alright? Like bring your head off the bed for me and rest your head in my hands. Alrighty? You don't want to just start off with the head hanging off the bed. Alright? Do people like that? Would you like that? No. Okay? Questions on that? With the trunk, with the thoracolumbar area, we're not going to be doing it because, to be honest, even if I'm strong, or do you think they're going to feel that comfortable in having their whole trunk ranged? No. I mean, that's when you're going to get to your ortho class. You're going to work on mobility of the trunk itself. He's going to show you a little bit about mobilization and actually, you guys are learning a little techniques now in myofascial release techniques, or you will be tomorrow, okay? You're gonna be learning about that, on how to work on the mobility of the trunk itself. Yes or no? Okay, so why don't you guys practice for the remaining time for goniometry, all right? Your exams, I will have every